Dave Regan, thank you so much for making time for us.
Sure, happy to be here. Thank you.
So, Governor Gavin Newsom is fighting your wealth tax, but he came out on Friday and pushed for a nationwide tax on billionaires and changes to the federal tax code. What's your response to that?
Well, I would hope that Governor Newsom would remember that he's the governor of the state of California, and 3.5 million people are about to lose health care coverage. Hospitals are closing, clinics are closing, and it's fine to make a proposal for a national conversation. He's obviously running to be the president of the United States, but this is an imminent, huge problem, and we have to deal with it now. And this is not a hypothetical debate. It's also worth noting that the last time the federal government, the US Congress, raised the minimum wage was 17 years ago. So I just don't think it's serious to say we're going to turn this over to the US Congress that hasn't been able to increase the minimum wage of $7.25 in 19 years, but somehow we're going to magically come up with a fair tax system that includes billionaires. This is about keeping people on health care coverage in California. The problem is now, and the governor needs to focus on the problem, not focus on his next campaign.
I mean, the governor, though, and other opponents of this, I think they're trying to make the point that a billionaire tax in one state just means that these wealthy people can get up and go to another to avoid this tax. I mean, you're not worried about that at all because, I mean, they're claiming it could be a huge loss in state funds for everything.
Well, their claims are entirely fabricated. There is absolutely no evidence that billionaires leave. Billionaires are the wealthiest people on the planet. They can live wherever they want in the world, let alone in the country. And all of the evidence, all of the research, all of the data that we have is that the very wealthy make this argument every single time. They most recently made it in the state of Massachusetts that passed a tax affecting millionaires. And today there are more millionaires in Massachusetts than there were when the tax passed. And everybody said they were going to go to New Hampshire and they were going to go to other states. It's just not true. The governor can say it as many times as he wants, but the facts are not on his side.
So you don't believe the billionaires who made arrangements earlier this year to leave? You don't think they're actually leaving?
No, I don't. And the other thing that's worth saying is that the tax that we're proposing is a one-time tax based on whether or not someone was a resident of the state of California on January 1 of this year. So there is no incentive for billionaires to leave. Their status as a legal resident is already it's already ingrained. And so even to pursue the idea that there's incentive to leave is just false. And all of the evidence again tells us that it's not true. And there's no reason to believe that these claims are true either.
And I mean, critics say, I mean, just to hone in and to basically get you, can you guarantee that this isn't going to be an everyone tax, essentially, as some people are claiming it would be, something that's going to impact everyone with a potential loss in funding? Like you're prepared to say that's not going to happen. SEIU-UHW can guarantee that.
Absolutely. This is a one-time emergency tax to address the collapse of our healthcare system in California and the loss of healthcare coverage for 3.5 million people. When it's passed, it will raise $100 billion to address that specific problem that no one, including the governor, has a solution for. The idea that putting $100 billion into the healthcare system to keep millions and millions of people in a secure position and facilities and clinics and hospitals open, this is adding revenue for a critical core thing. And the idea that somehow $100 billion more is going to be less doesn't make any sense. And I don't know why they're allowed to make these really nutty claims. There's no other way to characterize it.
I mean, in part with the help of billionaires, California already has an enormous budget and a lot of money to work with. I mean, at this point, potentially $350 billion for this upcoming state budget year. The bulk of that money is going to public schools. And then number two right there is healthcare. Lawmakers and the governor say they're trying to help with those cuts from the federal government. They acknowledge they can't completely fill all of them. But what do you make of how they're handling the situation on their own right now?
I think they're just ignoring the situation. Let's remember on July 4th of last year, when President Trump signed the One Big Beautiful Bill, it took $1 trillion out of the American healthcare system, $100 billion out of the California system over the next 5 years. That is real. Governor Newsom agrees that happened. Governor Newsom does not want to deal with this problem because, frankly, he's running for president, and these are the people that he has to raise enormous sums of money to prosecute his campaign. The governor of the state of California needs to deal with the fact that 3.5 million people are going to lose coverage in the next year, and that problem has to be solved. And he hasn't solved it, and he's said as much to us. So the other thing that has to be acknowledged here is billionaires pay very little in income taxes. Billionaires pay less effective tax rates, lower effective tax rates than you and I do. And for all of this talk, it's worth noting that California's 250 billionaires contribute 2.5% of California's income taxes. It's a small fraction. And that's for 250 people at 2.5%. These claims are just not rooted in reality. They're not true. And we have to have an honest debate about how are people going to keep healthcare covered.
Well, data from Governor Newsom's Department of Finance show that the top 1% actually contribute 20% total of the personal income tax in the state.
The top 1% is hundreds of thousands of people. There are 250 billionaires in the state of California. They're not the top 1%. They're the top 0.00001%. This is not about the top 1%. This is only about 250 individuals who've seen their wealth grow by 212% in the last 7 years because of the dynamism of California's economy. And if their wealth had grown by only 207% instead of 212%, nobody would even bat an eyelash. This is about protecting campaign donors. This is about putting the preferences of 250 of the most fortunate people on the planet ahead of the needs of tens of millions of Californians who need health care and are going to lose it.
Yeah, on the healthcare situation, other healthcare groups like the California Medical Association told us you did not consult with them as you put together this idea, that this is something that you basically put out on your own. I mean, is that true? Did you check in with other healthcare experts and providers on this?
Of course we did. And for the record, the California Medical Association, which is a trade association, an employer group, we spoke to the head of the medical association, a man by the name of Dustin Corcoran. And Dustin Corcoran, like too many political insiders in California, is more fearful of what billionaires think than he's mindful of what millions and millions of regular citizens in California need.
So will your coalition moving forward include, can we expect to see other healthcare groups join you in this fight?
Absolutely. We have all kinds of healthcare groups we have doctors, we have nurses, we have frontline healthcare workers like in our organization. The coalition has hundreds of members. It's growing every day. And now that we're going forward to the ballot, I think lots of people who've been watching this and waiting to see, is it really going to be on the ballot, are going to come out in favor of it because it makes sense. We're trying to solve an urgent and critical problem, and a large majority of the public believes this is the right thing to do. And despite all the misinformation from the governor and other elites, political insiders, people know what's real and what's not real.
Dave, your ballot measure, just given the approach to it by state lawmakers and the governor, both legislative leaders and the governor have opposed the billionaire tax that you're proposing. Voters back in 2024, they were in a similar situation with Proposition 36. That's a crime measure. I acknowledge it's a totally different topic here. But the governor and legislative leaders tried to fight that one too. And now, years later, after voters overwhelmingly passed that, there are still issues with administering and funding that law that voters chose. I mean, if your measure passes in a similar situation, do you trust our state's government leaders to administer and carry out what it is you're asking?
Absolutely. What we're asking is very, very simple. Again, The facts are what we're proposing affects 250 individual human beings. Everyone knows exactly who they are. They file their taxes every year. They've seen their wealth grow by $1.5 trillion in the last 7 years, and we're asking them for a one-time emergency tax of 5%, so 3.5 million people don't lose health care coverage, hospitals, emergency rooms, and clinics don't close, and that is perfectly reasonable. It is easy to administer a tax on 250 people, and everyone knows who they are, and everyone knows that they have to file their taxes every year is a matter of course.
But you're asking for 90% of that money to be spent on healthcare. I mean, you have specific asks with how that money is administered. And this state's government has, I mean, it has documented issues with administering programs. I just, again, want to confirm you trust that they would carry this out in the way you hope.
Yes, and absolutely. Again, let's remind ourselves the reason 90% of the revenue in our proposal goes to healthcare is because that's what President Trump cut in the One Big Beautiful Bill. He cut $1 trillion out of the American healthcare system, and that has to be fixed, or millions and millions of people are going to suffer unnecessarily, and people are actually going to die because they don't get the treatment that they need. So it's a simple tax. It affects 250 people. These are enormously wealthy people that, honestly, this is a rounding error for the folks that we're talking about. It's not hard to administer, and it addresses a critical, critical problem that nobody is putting forth a solution on, including Governor Newsom.
David, is there anything else you think we should know about your proposal headed to voters in November?
I just think it's important that to everyone to understand that we're going to hear all kinds of lies and misinformation from the billionaires themselves. And, Governor Newsom has, in our view, made a poor decision that he's siding with the billionaires over the needs of millions and millions of California consumers and patients. But people know what's right. This is the first time we're going to get a chance to fix a problem of this magnitude in a way that it ought to be fixed, that is fair, that is reasonable. And we look forward to the next 4 months and having this discussion. But the question is, how are we handling the potential of a collapse of the California healthcare system? And this is our solution. Nobody else has one.
All right, Dave Regan with SEIU-UHW. Really appreciate your time. Thank you.
Thank you, Ashley.